You were invited here because we expect you to be provocative. If an argument breaks out today, I will be very happy because that's the kind of dialogue we hope to have.
As soon as I understood what this initiative was going to be about, I had to make sure I made it here.
I'm very curious to see what bringing all of these people with very different perspectives might come up with.
We definitely need African voices speaking for diversity, for African inclusion in the decision making around how we deliver healthcare.
Well, I'm really interested in how to scale innovation and how to understand the barriers that exist and hopefully remove some of them.
Seeing how great system thinkers here at MIT explore the topic.
A completely new way of looking at the healthcare innovation, environment.
Solutions. We need powerful solutions.
I want to transform the healthcare system, not just in the United States, globally.
We will spend a bit of time mapping together, but more importantly, having a conversation about where the dysfunction in the system is. The most critical aspect of this exercise this morning is seeing the system together as it is.
We're not trying to make a perfectly accurate map of all healthcare. We're trying to use a systems framing to lead us to insights, right? Understanding interconnections, structures.
Why is it the system doesn't change? Who has what to lose by changing? And what are the losses involved?
Is there more we can do to understand what's driving behaviors as opposed to what is their behavior?
If a health system's primary incentive is to stay viable as a business, it'll do the things that make itself money, not necessarily the things that serve the needs of patients. As an example, hospital systems in the US are paid when people are sick. When their beds are empty, they don't make money. That's a conflict that misaligns purpose.
Current system is not working for any of us in any single country, in any single state, in any single location.
Medicare by itself is not a solution of access because an 80 years old or 75 years old who's in rural Georgia have Medicare, but they have no way of getting the care.
Not all patients are equal, and unfortunately the crying baby gets the milk, and the people who are the crying babies are the ones with the money.
I wondered if in all these models there is reduction in cost for the centralized structure. I'm yet to meet a government that decentralized because it's going to cost more money.
A lot of these problems are not actually a conspiracy of finance. They're also cultural, they're institutional, and a lot of them are behavioral. And I think we need to tackle that head on.
The consumer's voice is often missed, whether it's the design of federal assistance programs like WIC or SNAP or Medicaid or Medicare, whether it's the National Cancer Institute.
What we know about the problems with healthcare could fill a library, and what we know about solutions, could fill a matchbox.
We're not interested in more fairy tales and more interesting bedtime reading. We are interested in action.
COVID vaccines, are they free in Egypt?
Yeah,
okay.
Completely free. They actually, it's illegal to sell COVID vaccines in Egypt or charge any fees.
This is what I wanted to ask actually. Where did they get their money from and on what basis and who are they aligned with?
In some ways what we're saying is that actually just talking about decentralization doesn't quite capture how profound this is.
Just so very fortunate to be surrounded by so many amazing thinkers and humble thinkers too.
It was a profound event, quite insightful, especially drawing from the intellectual capital in the room.
All of us were able to contribute from our own different perspectives.
I think COVID has revealed to us just how dysfunctional global health systems are, and it was important to bring a very diverse group of stakeholders together to think about how we can transform the system in a way that would work for everybody.
This roundtable represents a start to something that's not perfectly defined, but clearly has a shared intent and a collective aspiration.